What is the plague in 2025? How many types are there? Symptoms and prevention. Part 1. What is the plague? Hi everyone, I'm Dr. Andrew Collins. I currently practice medicine in the United States, and I'm passionate about sharing medical knowledge with the public through videos like this. Today, I want to take you back in time to explore a disease that once struck terror across the globe, the plague. You might have heard of something called the Black Death, one of the deadliest pandemics in human history. But really, what is the plague? And why is it that even now, modern medicine still keeps a close eye on it? The plague is an extremely dangerous infectious disease caused by a bacterium called Yersinia pestis. I still remember the first time I learned about it in med school. My professors made it very clear. If not diagnosed and treated quickly, the plague can kill within days, or even hours. Sounds like something out of a medieval horror story, right? But the truth is, this disease still exists, and new cases pop up every year in different parts of the world, including right here in the U.S. Here's the thing. This bacteria doesn't just float around in the air. It's usually spread to humans through the bite of an infected flea, especially fleas that live on rats or wild rodents like squirrels, rabbits, or even wildcats. On top of that, if you come into contact with the blood or tissue of an infected animal, or inhale droplets from a person with pneumonic plague, you could be at risk too. I once treated a patient who worked at a wildlife reserve. He handled a dead squirrel without wearing proper gloves. A few days later, he was in the hospital, high fever, swollen lymph nodes, shortness of breath. The test results came back. It was the plague. Thankfully, he got treatment in time, but not everyone's that lucky. This isn't just a story about medicine, it's a lesson in health awareness. What we learn today might save someone else's life tomorrow. Part 2. How many types of plague are there? In this video, I'll dive deeper into the 3 types of plague, how to recognize them, why the pneumonic form is especially dangerous and can spread quickly through the air, and what makes the septicemic form a silent killer. Now that we understand what is the plague, it's important to know this. The plague doesn't come in just one form. In fact, there are 3 distinct types, each with its own symptoms, level of danger, and method of transmission. 1. Bubonic plague. This is the most common form, accounting for over 80% of the cases I've encountered or read about in medical literature. Imagine this. You're bitten by an infected flea, and not long after, you start feeling feverish, chilled, your body aches all over. But the worst part? A painful lump starts to swell in your groin, armpit, or neck. That lump is a lymph node, and it's where the bacteria are multiplying. I once had a young patient who was admitted to the hospital with what seemed like mumps, but the test results revealed it was actually bubonic plague, because the family lived near an area infested with wild rats. The good news? This form doesn't spread from person to person, and if caught early, it responds well to antibiotics. But if treatment is delayed, the bacteria can spread deeper into the bloodstream or lungs. 2. Pneumonic plague. This is the most dangerous form because it can spread from person to person through respiratory droplets, just by breathing in particles from someone coughing, sneezing, or even talking nearby. I remember a case in New Mexico, a male patient who was diagnosed late. He was coughing up blood and went into respiratory failure within 48 hours. He had to be intubated and moved to intensive care. Sadly, he didn't survive. Classic symptoms include a dry cough that turns bloody, high fever, chest pain, rapid breathing, and extreme fatigue. Without treatment within 24 to 72 hours, the mortality rate is almost 100%. That's why pneumonic plague is considered a serious public health threat, especially in crowded places or areas with limited medical infrastructure. 3. Septicemic plague. This form can develop from the other 2 types, or appear on its own. It attacks the bloodstream directly, leading to a life-threatening condition called sepsis, a medical emergency. Patients may develop dark purple patches under the skin, tissue death in fingers and toes, abdominal pain, diarrhea, and even go into shock, and it all happens very fast. I worked in an ICU and witnessed patients crash within hours. Their bodies stopped responding to medications, blood pressure dropped, and one organ after another started shutting down. It's something you never want to see. Septicemic plague has earned the nickname the silent killer because it starts off with no obvious symptoms, making it easy to miss until it's too late. To sum it up, whether it's bubonic, pneumonic, or septicemic, the plague is not something to take lightly. But here's the most important thing I want you to remember. It is absolutely treatable, if caught early and treated promptly. More importantly, understanding the facts and knowing how to prevent it is the best way to protect yourself and your loved ones. That's why I made this video. To raise health awareness so our community doesn't respond with fear, but with knowledge and confidence in protecting our health. Part 3. Symptoms of the 3 types of plague. Now let's go a bit deeper. Let's say one day you or someone around you starts showing unusual symptoms. How would you know if it might be the plague? 1. Symptoms of bubonic plague. This is the type I've personally seen in several real-life cases. It often starts off looking like the flu but can take a sudden and serious turn. Common early signs include sudden high fever, often with chills all over, extreme fatigue, muscle aches, and intense headaches. And the most telltale sign, swollen lymph nodes, typically in the groin, armpits, or neck. But it's not just swelling, they are painful. Even a light touch can make the patient wince in agony. I once asked a patient to describe the pain. He said, "Doc, it feels like a hot battery just exploded inside me." 2. Symptoms of pneumonic plague. This form makes me the most anxious in the ER because of how quickly it spreads. Patients usually start with high fever, chills, and sometimes early shortness of breath. Then, a dry cough that turns bloody, and sharp chest pain, rapid breathing, gasping for air, and feeling like something's crushing your chest. This form can escalate within just 1-2 days. If you've ever watched someone struggling to breathe, lips turning blue, you'll understand why pneumonic plague is so terrifying. And since it spreads person to person, every minute of delay puts more lives at risk. 3. Symptoms of septicemic plague. This is the silent but deadliest form if not detected in time. Often, there are no early clear signs, which makes it dangerously easy to miss. But once it takes hold, patients may develop dark purple patches under the skin due to internal bleeding, tissue death in fingers or toes, abdominal pain, diarrhea, and shock. I've seen patients in the ICU deteriorate within hours. Blood pressure drops, organs fail, and nothing responds to treatment. It's devastating to witness, and a reminder of just how critical early detection is. Early symptoms are often vague in the beginning. The signs can be subtle, maybe just a high fever, stomach pain, and nausea. But within just a few hours, patients may start showing internal bleeding under the skin, bruises that look like they've been beaten. Then, dark, blackened patches of skin begin to appear, especially on the fingers and toes, where tissue begins to die, necrosis. This can lead to septic shock, plummeting blood pressure, loss of consciousness, and a very high risk of death. I once witnessed a case of septicemic plague where the patient's hand turned dark purple-black in just 5 to 6 hours. That's the moment you realize, this isn't just textbook theory. This is a real race against time. All 3 forms of plague can cause a person's condition to collapse incredibly fast. But here's the danger. The early symptoms are often mistaken for something else. Many people think it's just a cold or swollen glands, until it's too late. So, if you, or anyone you know, lives near forests or mountains, works with wildlife, or shows any of the symptoms we've talked about, please seek medical help right away. A little awareness, the right knowledge, and just a bit of health awareness can save lives. Part 4. How to prevent the 3 types of plague. So, after hearing how dangerous the plague can be, you might be wondering, is there any way to prevent it? And the answer is yes. Plague can be prevented if we take the right steps at the right time. Let me share with you the most effective prevention methods based on guidelines from the CDC, Centers for Disease Control and Prevention, along with what I've learned treating real patients. Preventing bubonic plague. As I mentioned earlier, bubonic plague is mostly spread by infected fleas living on rodents like rats, squirrels, and rabbits. So the key here is simple. Avoid contact with risky animals and control flea exposure. Here's what I usually recommend to my patients. Don't keep, touch, or play with wild animals, even if they seem cute or appear to be dead. If you live or camp in wooded or mountainous areas, always use insect repellent. Wear long sleeves, long pants, and socks, and avoid lying directly on the ground. Keep your home and surroundings clean, and prevent rodent infestations, since fleas often hitch a ride on them. 2. Preventing pneumonic plague. This type spreads through the air via respiratory droplets from an infected person. That means if someone coughs or sneezes and you're nearby, you can get infected, even if you've never touched an animal. So what can you do? If you're living or working in an outbreak zone, wear an N95 mask when around people who might be infected, especially in enclosed spaces. Avoid crowded places if you have fever or a cough, not just to protect yourself but also to protect others. And if you've been in close contact with someone who might be infected, get checked immediately, even if you don't have obvious symptoms yet. I've personally treated a patient with pneumonic plague, and trust me, that standard medical grade mask saved me. Small actions that seem simple can actually be life-saving. 3. Preventing septicemic plague. This form is especially dangerous because it can develop from the other 2 types. So if you've already done a good job avoiding bubonic and pneumonic plague, you've already reduced your risk of septicemic plague by 90%. But here are some extra precautions to keep in mind. If you have open wounds, never touch the blood or tissue of wild animals. Never handle or dissect animal carcasses without proper protective gear. And if you've been bitten by fleas or feel feverish after hiking or camping, tell your doctor right away that you suspect plague, because early detection can make all the difference. One final thought. The plague can be deadly, yes, but it's not something we need to panic about. It's something we need to understand and prevent wisely. Thanks to modern medicine, most patients, when treated with the right antibiotics at the right time, can make a full recovery. But don't wait until things go too far to start worrying. Act early. Act smart. For yourself and for the people you care about. Part 5. Treatment for plague. We've now gone through what the plague is, the different types, their symptoms, and how to prevent them. But what if, despite all efforts, someone still ends up infected? Is there still hope? The answer is yes, absolutely. There's a strong chance of survival if the disease is caught early and treated properly. Modern treatment for the plague. Today, the plague can be effectively treated with antibiotics, and the key is to start treatment within the first 24 hours of symptom onset. Some of the most commonly used antibiotics in hospitals include streptomycin, gentamicin, doxycycline, ciprofloxacin. Depending on the type of plague and the patient's condition, doctors will prescribe the appropriate regimen. Patients who are admitted early and follow their treatment plan usually recover well without serious complications. I once treated a patient with bubonic plague. He came to the hospital after 1 day of fever and swollen lymph nodes. We immediately started antibiotics and supportive care. Within just 72 hours, the fever dropped, the swelling subsided, and he made a remarkable recovery. That experience reinforced my belief. Knowledge plus timely action equals survival. Additional medical support. Along with antibiotics, plague patients often need medical isolation especially in pneumonic cases, to prevent community transmission. Close monitoring for respiratory failure or sepsis, especially during the first 48-72 hours. IV fluids, blood pressure control, and organ function support. Kidneys, liver, if complications occur. In severe cases, ICU care, mechanical ventilation, or respiratory support. I always remind my young colleagues, treating the plague isn't just about prescribing antibiotics. It's about close observation, quick response to changes, and truly being there for your patient. Is there a preventive medicine or vaccine? Currently, there is no widely used official vaccine for plague, although some countries are developing and testing them. However, preventive antibiotics can be prescribed to people who've had close contact with a confirmed case. For example, if you live with someone diagnosed with pneumonic plague, your doctor may prescribe doxycycline for 7 days as a precaution. You see, the plague is not a death sentence, as many people mistakenly believe. With the right knowledge, awareness, and prompt treatment, this disease can absolutely be defeated. The most important thing is this: know to prevent, understand to eliminate fear, act to protect yourself and your community. If you found this video helpful, please share it with your loved ones or friends. Or simply subscribe to this channel and join me on this journey of discovering the deeper sides of medicine, of life, and of the things no one ever really tells you about.